Hello everyone, my name is Randy Cooley and it's an honor to be here in front of you guys today. So let's get started, okay? So what I want you to do is, by a show of hands, please let me know if you agree with the following statement, okay? So inside our bodies, there's an intelligence that controls and coordinates all of its functions. Excellent. And again, by a show of hands, do you agree that a subluxation can interfere with this intelligence and affect the quality and the condition of life? You're doing great. And lastly, an individual can present with a subluxation who may or may not be presenting with any symptoms. All right, great. So, if an individual were to walk into your office and they weren't presenting with any symptoms, how would you know that they're in fact subluxated? How would you locate the subluxation? How would you correct the subluxation? But most importantly, how would you know that the subluxation has been corrected? See, it's my observation that the majority of chiropractors are judging their care based on the removal of symptoms rather than the removal of the vertebral subluxation. And as chiropractors, we've been given a healing art based on one thing: the vertebral subluxation complex. It's our thing. It's what makes us unique among other healthcare professionals, and we should be extremely proud of that. Wasn't expecting an applause there, but thank you. But I'm extremely proud today to be presenting on the Pierce Results System, okay? The Pierce Results System is a complex system of analysis centered around locating, correcting, and monitoring the correction of the vertebral subluxation complex. So what is a subluxation? Well, if you're like me, and you think that there are far too many definitions of exactly what a vertebral subluxation is, let's narrow it down a little bit, okay? According to the research by the one and only Dr. Matthew McCoy, there are two components that are common to every and all definitions of a subluxation. Those two components are, one, biomechanical dysfunction, and two, neurological dysfunction. So if we just look at these two components, we can see that both can be measured using valid, reliable, and objective means. So here at the Pierce Results System, we utilize technology to measure both of these components in our patients. The first tool that we use is low radiation video fluoroscopy. Video fluoroscopy is the gold standard in spinal motion analysis. We study the spine in motion because as humans we're constantly moving. It's motion that keeps us alive. It's motion that keeps our discs healthy, our joints healthy, our ligaments healthy, our muscles healthy. So with this tool, we're able to see objectively what bones in the spine are moving properly and which ones are moving improperly. So this device allows us to pinpoint the exact biomechanical dysfunction in our patient's spine. So this tool, video fluoroscopy, is a tool that we use to check our patients for the first component of the vertebral subluxation complex, biomechanical dysfunction. The second tool that we use is thermography. So what do we use thermography for? Well, what if I were to stand up here and tell you right now that I can bench press 650 pounds? Easy, no problem. The first thought that probably came to your mind was, well, of course you can, look at you, right? But some of you skeptics out there might say, prove it, show me. Well, as chiropractors, we go around saying we're affecting the nervous system, so prove it, show me. That's exactly what we use thermography for. The tool that we use for thermography is called the Titron. The Titron is a dual-probed digital infrared thermography instrument that measures the heat coming off the capillaries 5 millimeters beneath the skin. Those capillaries are directly controlled by the nervous system. Therefore, this tool gives us an accurate depiction on exactly how our patient's nervous system is functioning. So this tool, thermography, is how we not only show to ourselves as doctors, but how we show to our patients the second component of the vertebral subluxation complex, the neurological dysfunction. Now, utilizing these tools in the Pierce Results System makes us unique for three reasons. The first reason is that utilizing this technology makes it easy for us to communicate with other healthcare professionals. It takes all the skepticism out of what they might have thought about chiropractic because we're able to show them exactly why we're making the adjustments to the spine. In fact, the office that I'm interning at right now just had a representative from the neurology department at the Mayo Clinic come into our office. He wanted to check out offices to see maybe for a good referral source for pre-surgical patients as a less invasive approach. Pretty cool, right? So the feedback that we got was fantastic. He said he loved what we were doing because we were able to prove that what we said we were doing, well, we were actually doing it. See, Dr. Pierce said it the best. If you do it and you can't prove that you did it, well, then you probably didn't do it at all. Now, the second thing that makes us so unique is that this technology allows us to make our adjustments very specifically and allows us to see our patients less. Let's be real here. None of us want to go to any type of doctor 3 times a week for months on end. So why would we expect that our patients want to do that? With this technology, we're able to get results with seeing our patients less, and our patients love that. When they love something, they talk about it, and when they talk about something, it stimulates referrals for you. Now the third thing, and probably my favorite thing about the Pierce Results System and utilizing this technology, is that it allows us to correct the spines of just about every different type of population, utilizing only pure, specific chiropractic adjusting. So those types of populations include children, adults, elderly with degeneration, and even surgical fusions. They need help too. You analyze around the surgery and you adjust accordingly. Now, the Pierce Results System is for those of you who want to challenge yourself to be better for your patients. It's for those of you who need to know why you're making those adjustments to those segments, and it's for those of you who want to check your work. Because if you're not checking your work, how do you know that you're doing what is right for your patients? With the Pierce Results System, you won't have to guess if your patient's subluxated. You'll be able to show them that they're subluxated. And that's just about as real as it gets. Thank you, guys.